I'm Executive Director Kevin Robertson, and this is the KDA Video Minute for Wednesday, February 18th. We're shooting a midweek Video Minute this week because we didn't do one last Friday, and so we have some things coming up that we wanted to make sure that you were aware of. First of all, on Monday and Tuesday, February 23rd and 24th, the Senate and the House are both having hearings on the mid-level issue, Senate Bill 49, House Bill 2079. So as we've put together a great team on both of those days to come and testify on our behalf with regard to those, but please contact your legislator if there is someone that you are aware of, that's on that committee. You'll find the list here and the link here, but please contact your legislator prior to next week and let them know about your position on the mid-level issue. While we're talking about legislative issues, just Monday of this week, we had a hearing on House Bill 2202. That's the bill that the Kansas Dental Association introduced regarding Medicaid audits. It's a bill that would make it illegal for the state to use extrapolation when determining recoupment, unless the total recoupment was based on an estimate of $150,000 or more. It also requires a like provider to be involved in the audit process and the appeals process, requires a 30-day notice of an audit so you have time to prepare. There's some other things in it as well. The hearing went very well. Dr. John Fales testified as well as myself in support of that bill. There's some things with the bill that need to be tweaked a little bit, so we're trying to get that done as legislative deadlines approach at the end of next week. So kind of stay tuned to that, and certainly contact your House Health Committee members. Again, the House Health Committee members are also included here, and let them know if you've been involved in an audit, if you're a Medicaid provider and you're concerned about that possibility, and trying to put sanity into Medicaid audits. And lastly, of course, we just had the 2015 Kansas Mission of Mercy in Salina. Came on Salina was fantastic. Like always, a lot of great volunteers, a lot of dentists involved, about 135, 140 dentists, final count were involved in that, over 1,000 volunteers in all. At the end of the day, we treated exactly 1,400 patients, and we're just a little bit short of $1.2 million in dental care over those 2 days of treatment. So great event. I have to thank Dr. Mark Herzog, Dr. Earl O'Hara, Dr. Jason Wells were the chairman of the local arrangements committee, and a great committee underneath them. And I don't want to start naming everyone because I'll forget someone, but it was Salina did a fantastic job. We're very excited about the work they did. We hope that you will all be involved in KMOM 2016. KMOM 2016 will be in Topeka at the Kansas Expo Center. It will be February 26th and 27th, and so we look forward to your participation next year in Topeka. As we wrap up the Video Minute today, I'd like to thank all the sponsors out in Salina and around the state that contributed and made KMOM Salina possible. You'll see a list of those scrolling as we wrap up. Have a great week, and we're not sure exactly what day we'll be back next week with the Video Minute. This sort of depends on what's going on. So thank you very much, and have a great week.